In this video we will study process of program evaluation in the context of community psychology.
Evaluation is not just an activity performed by social scientists. We all engage in what is essentially program evaluation, and we do it basically every day. In program evaluation, we are often concerned with two major points. 1. Did it work? And 2. Why or why not? How can we analyze a program to see whether it is working, that is outcomes, and why it is working or not working, that is process? There are at least two reasons why programs do not work: theory failure and implementation failure. Theory failure concerns program theory, the rationale for why a particular intervention is considered appropriate for a particular problem with a specific target population in a particular cultural and social context. Implementation failure concerns quality of program implementation. You may have an excellent program theory that has been demonstrated elsewhere to work with your target population, but the implementation in your location may be weak due to a lack of resources, inexperienced personnel, insufficient training, or other reasons. When you go to a new restaurant, you are engaged in evaluation. In a restaurant, you think about the quality of the service, the quality of the food, the cost, and the atmosphere. If the service was slow, the food was nothing special, and the cost was high, you probably will not go there again. And you will probably disseminate your results. If a friend asks you about your experience with the restaurant, you will give your data: poor service, mediocre food, and high price, and your overall evaluation. Do not bother going there.
It is important for school and community practitioners to use causal thinking and, as much as possible, to develop a causal model for a community program. That logic model can then indicate questions for evaluation of program process and outcome, which will help demonstrate program effectiveness. The principal purpose of a causal logic model is to show in a simple, understandable way the logical connections between the conditions that contribute to the need for a program in a community, the activities aimed at addressing these conditions, and the outcomes and impacts expected to result from the activities. The logic model is a graphic representation of how the program works. 4-step logic model that can be applied to program evaluation. Its top row consists of 4 circles, representing program conditions, activities, outcomes, and impacts. The circles are linked together with lines that show the expected logical relationships among them based on the program theory. These relationships among circles also show the sequence of intended events that occur as a result of program activities. In the first circle, conditions include risk factors or processes, community problems, or organizational difficulties that the program seeks to address. The second circle includes the activities that address each condition. One or more activities can aim at solving each of the conditions. The third circle contains the immediate outcomes that result from the activity, for example, changes in knowledge or attitudes of program participants or changes in local laws or organizational policy. The fourth circle concerns the eventual impacts of the program on the community at large. The middle row shows the steps in program development and their relationships to the logic model. A program developer assesses the need for a program, often with community surveys or interviews, plans a program to address the need, implements the program, and evaluates whether the program has been successful. The bottom row shows how a 4-step model of program evaluation relates to the logic model and to program development.
4-step program evaluation includes: Step 1. Identify goals and desired outcomes. Step 2. Process evaluation. Step 3. Outcome evaluation. Step 4. Impact evaluation. Step 1. Identify goals and desired outcomes. Starting with goals sets the project's sights. Goals represent what a project is striving for. Goals tend to be ambitious and set a framework for outcomes. Outcomes are more specific and represent what the project is accountable for. Goals can be general, outcomes must be specific and measurable. If a community initiative addresses a wider community issue, the changes it seeks to create indicate its goals and desired outcomes. Primary goals, such as increasing parent involvement in the schools or reducing drug use. Target groups, such as teachers, children of a specific age, parents, or general public. Target groups can be described by demographic characteristics, developmental transitions, risk processes, locality, or other criteria. Desired outcomes, such as decreases in school absences. Well-formulated outcomes are clearly defined and specific, realistic and attainable, and measurable. Specific questions in first step of program evaluation. Make a list of the primary goals of the program. What groups did you want to involve? What outcomes did you desire? Step 2. Process evaluation. In Step 2, the activities designed to reach the desired outcome are described. They answer the question, what did the program actually do? Purposes of process evaluation. First, monitoring program activities helps organize program efforts. It helps ensure that all parts of the program are conducted as planned. It also helps the program use resources where they are needed, for example, not spending most of its money on only one activity or target group. Furthermore, it provides information to help manage the program and modify activities, leading to mid-course corrections that enhance the project's outcomes. Second, information in a process evaluation provides accountability that the program is conducting the activities it promised to do. Third, after a later evaluation of outcomes and impacts, the process evaluation can provide information about why the program worked or did not work. Fourth, process evaluation can help you decide whether you are ready to assess the effects of your program. Fifth, conditions sometimes change and what was planned is not what actually happens. Process evaluation helps keep track of such changes. Answering process evaluation questions before, during, and after the planned activities documents what actually happened. Conducting a process evaluation. What were the intended and actual activities of the program? Regarding activities, process evaluation asks, who was supposed to do what with whom and when was it to be done? Who refers to the staff delivering the services? How many staff members? What kinds of qualifications and training do they need? What refers to what the staff are asked to do?
Whom refers to the target groups for each activity. When refers to the time and setting of the activity, for example, during school assemblies, after school. The more clearly the questions are answered, the more useful the process evaluation will be. Specific questions asked in second step. A. What activities were implemented? Total duration of all activities, in hours. B. What can you learn from this Step 3. Outcome evaluation. Outcome evaluation assesses the immediate effects of a program. The bottom line of program evaluation concerns short-term or immediate effects of a program on its participants or recipients. Outcome measures these should be closely linked to goals but more specific. There are several potential ways to measure outcomes. Self-report questionnaires are commonly used to measure outcomes. They must be chosen with care, and their reliability and validity should be considered. The test/retest reliability, stability, of a measure is a particular concern if it is to be given before and after an intervention. Construct validity, the extent to which a questionnaire measures what it claims to measure, also is an important concern. Other data collecting means are in-depth interviews with key informants or participants are excellent sources of qualitative data. Behavior observation ratings may be useful, although they are often challenging to collect and analyze. Step 4. Impact evaluation. Impact evaluation is concerned with the ultimate effects desired by a program. In alcohol and other drug prevention programs, the ultimate effects might include reduction in overall drug use, prevalence, reduction in rate of new students starting drug use, incidence, decreases in drunk driving arrests, and decreases in school disciplinary actions for drug or alcohol offenses. Outcomes, Step 3, are immediate or short-term results of a program, whereas impacts, Step 4, are longer-term effects of the program. Archival data, based on records often collected for other purposes, help assess impacts. Examples include medical records, juvenile court or police records, or school grades and attendance records. The direct effects of the program, such as the degree to which a drug use prevention program increased knowledge of drugs and the perceived risk of using drugs. Although the 4-step program evaluation method was initially developed for evaluation in the alcohol, tobacco, and other drug abuse domain, but it is adaptable to any program area, such as community-based mental health prevention. Hope you liked this lecture. Stay tuned for the upcoming lecture on linking program evaluation to program development. Thank you.